Hi everybody, I'm Dr. J. Burness, and after a long delay, this is the 8th and final video in our PCS series. If you've been watching the other videos in the series, it's likely you or somebody you know has had a concussion. You may even recognize some of the symptoms and the difficulties we've discussed so far. And at this point, you may be curious about what's involved with treatment. So today I'd like to lay out what a typical PCS patient will experience through the initial assessment, the diagnostic testing, reported findings, and treatment in our clinic. Since every case is different, it's impossible for me to go over every possible treatment scenario, but the basic framework of our process is the same for everyone. Most potential new patients will initially contact me directly through our webpage. There's usually a short email exchange between myself and the patient regarding the details of their case. If I think I may be able to help them, I'll usually suggest at this point that they call my office to book a consultation. Prior to the consult, you'll be asked to complete and return some preliminary health history paperwork, and that's so I can familiarize myself with the case before we meet. The paperwork is available for download from my website, or my staff can email it to you directly when the consultation appointment is made. At the consult, we'll discuss the details of your injury and your symptoms to begin to narrow down which areas of the brain may be involved. I may do a couple of tests that are pertinent to your symptoms right then, just to see if it's worthwhile to proceed with the full examination. If I think I can help, we'll be able to book the appointments for the neurological exam and the diagnostic testing right then. During the neurological exam, we'll assess the overall function of your nervous system, including the autonomics. We'll also do some additional testing of the areas of the brain and the sensory and motor systems that are relevant to the symptoms you're having. As you may have gleaned from the other videos, I use a lot of eye function tests to assess brain function. Vision is the only sense that uses almost all the areas of the brain in one way or another. Because different visual tasks use specific pathways and areas of the brain, they can be useful to determine which areas of the brain are injured. During the diagnostic testing session, we'll use video nystagmography to test how well your eyes can hold, track, and capture both still and moving targets at different speeds and directions. We may also run some balance tests at this visit using force plate posturography. Now, most PCS patients will find this testing session very tiring, since weak and injured areas of your brain are going to be challenged. For this reason, it's a good idea to have someone else drive you to and from this appointment. Once all the testing is complete, we'll set an appointment for the reported findings. At that session, we'll take a half an hour or so to go over the detailed findings of the exam and the diagnostic testing, as well as a treatment plan that's specific to your injuries. So finally, that brings us to treatment. In the simplest of terms, treatment will drive plasticity in the injured neural pathways that we identified in your exam and diagnostic testing. Over the course of your treatment, we're also going to change your diet to reduce inflammation in the brain and to provide the nutritional building blocks for the formation of new neural connections. So how does treatment look exactly? Well, every case is different, but a typical treatment session will last a little over an hour. During that time, we may perform some stimulations on your tongue and face, as well as some brain-based exercises specific to the pathways involved in your case. Sometimes there are simple eye movements or combined eye, head, or body movements. Other times we may need to do rhythmicity and timing drills, or specific vestibular and balance stimulations, vagal stimulation, stop-start visual tasks, and many others. You might even be wearing a head-mounted laser at some point, or listening to clicking tones through the bones of your skull while walking and doing figure-8 motions with an arm. There are literally hundreds of possible applications. It's all very specific to the patient and the injuries and capacities that they have. But one thing that's common to all patients is that the treatment is active. If you're working with us, you will be busy. To drive plasticity, the injured pathways need to be used. Because they're weak, we may need to start activating them very gently and indirectly at first. It's important to keep tabs on you as you go as well. Each exercise and stimulation can only be done within the capacity of your injury. Pushing too hard does not help. At each session, we'll determine how many repetitions of each stimulation or exercise you can tolerate. At the end of the session, you're going to have some homework to do until I see you again. Over time and subsequent sessions, as you improve, the activities will progress in intensity and duration. Typically after 12 sessions, we'll rerun the exam and the diagnostic testing to see how you're doing. Most patients will be feeling improvement by this point and may decide to finish or to continue with treatment as appropriate. So that's it. Does that sound good? Does that sound like an approach that's been missing so far in your recovery? If so, reach out to me through my website or call my office to start the discussion. If I'm too far away from you, I'll be happy to refer you to the closest colleague who can help. Good luck with your recovery, don't give up, and thanks for watching.